The bladder is a hollow, muscular, membranous organ located in the anterior region of the pelvis, which has the task of collecting urine, which is filtered by the kidneys before being eliminated from the body with urination. When one of the cells lining the internal surface of the bladder accumulates a series of genetic mutations, it can lead to neoplastic transformation and therefore to an anomalous and uncontrolled proliferation of bladder cells, thus giving rise to the formation of a tumor mass. Bladder cancer represents approximately 3 of all tumors, with an incidence 3 times higher in men than in women, and in particular in the age group between 60 and 70 years. In 2022, approximately 29,200 new diagnoses of bladder cancer were estimated, of which 23,300 were in men and 5,900 in women. It is the 4th most frequent type of cancer among men, preceded by prostate cancer, lung cancer, and colorectal cancer. As the Italian Association for Cancer Research reminds us, the symptoms with which bladder cancer can present are also common to other diseases that affect the urinary system. But what are the most frequent signs and symptoms of bladder cancer? Let's go see them. Hematuria. Among the initial symptoms of bladder cancer, we find hematuria, medical term used to indicate the presence of blood in the urine and is classified based on the quantity of red blood cells present within it. We speak of macrohematuria when the amount of blood in the urine is sufficiently abundant to visibly change its appearance, which will thus take on a color ranging from bright red to dark brown. Instead, we speak of microhematuria when the amount of blood in the urine is insufficient to be visible to the naked eye, but can only be detected through a microscopic examination of the urine sample. The origin of hematuria in bladder cancer is generally due to bleeding from the tumor itself, as by increasing in size, it can break the blood vessels inside it and therefore cause bleeding, which is then visible in the urine. There is also a condition called pseudohematuria or false hematuria, in which the urine takes on a reddish color, but not due to the presence of blood. The cause can be attributed to the excessive intake of certain foods, such as beets, blueberries, rhubarb, or food colorings, as well as the intake of some drugs and supplements. Bladder cancer is just one of the possible causes of hematuria, as there are also other medical conditions that can cause the presence of blood in the urine. Some of these are urinary tract infections, kidney disease, enlarged prostate, but also trauma or injury to the urinary tract. Dysuria. Another of the symptoms associated with bladder cancer is dysuria, a pathological condition in which there is difficulty urinating, sometimes accompanied by pain and burning. In some cases, it is associated with vesical tenesmus, that is a spasmodic and painful contraction of the bladder sphincter with a continuous sensation of having to urinate. This is because the tumor can irritate the inside walls of the bladder and cause a burning sensation when urinating. The infiltration of the tumor mass can trigger an inflammatory response in the body, during which chemical substances such as cytokines are released, which contribute to further irritating the walls of the bladder and worsening this symptomatic picture. The inflammation can also involve the nerves of the bladder and urinary tract, thus intensifying the perception of pain and burning during urination. The tumor, especially if it invades or involves nearby nerve endings, can stimulate the bladder nerves improperly and cause an increase in the frequency of bladder muscle contractions, particularly of the detrusor muscle. It is a smooth muscular layer that envelops the bladder and which, through a relaxation and contraction phase, allows it to be filled and emptied. The tumor can therefore interfere with the coordination of the detrusor muscle and increase its nervous sensitivity, leading to an excessive response and irregular and more frequent contractions of the muscle. Pollakiuria. Pollakiuria is a medical term used to describe a transient or permanent increase in the frequency of urination, accompanied by a reduction in the quantity of urine emitted during each urination act, without necessarily increasing the total volume of urine produced over the course of 24 hours. If the tumor mass grows to the point that it partially obstructs the flow of urine, it can cause an increase in pressure inside the bladder, making you feel a constant need to urinate and a feeling of constant urgency. Obstruction can also limit the ability of the bladder to empty completely, favoring urine stagnation and therefore an increased risk of contracting urinary tract infections. Among the most frequent ones we find cystitis, inflammation of the bladder mucosa, generally of bacterial origin. When the infection instead affects the urethra, that is the last part of the urinary tract that connects the bladder with the outside of the body. It is called urethritis. However, when the bacteria present in the bladder travel up the ureters and reach the kidneys, pyelonephritis occurs, bacterial infection of one or both kidneys. Pelvic and lumbar pain. Bladder cancer can cause pain at different stages of the disease and depends on its size, location, and possible involvement of surrounding structures. Pelvic pain, for example, could be one of the warning signs of bladder cancer and is perceived as a discomfort affecting the lower part of the abdomen, or more specifically, the pelvis. This is the anatomical region that includes the pelvic cavity and the organs and tissues contained therein. Pain in this area can manifest itself continuously or through spasms, that is, with sudden and involuntary muscle contractions, accompanied by peaks of acute pain, alternating with moments of absence of pain. The pain may start in the pelvic region, and as the tumor grows, it may extend into the lower back. Pain that typically affects only one side of the back, but can also be located centrally. Pelvic or lower back pain are less common symptoms of bladder cancer, and which generally appear in the more advanced stages of the disease, but which is still important not to underestimate, especially if associated with one or more symptoms described in this video. Other disorders that may occur include bone pain, tiredness, leg swelling, and unintentional weight loss due to the deleterious effects of neoplastic processes on energy metabolism. We remind that the presence of one or more symptoms described in this video do not necessarily indicate the presence of a bladder tumor, as they are very similar to those of other diseases that affect the urinary system. For this reason, if you notice any signs such as a change in the appearance of your urine, difficulty or burning during urination, it is important to contact a specialist. Only thanks to specific clinical and diagnostic tests such as urinalysis, ultrasound, and cystoscopies is it possible to identify the exact cause of the symptoms and determine whether or not bladder cancer is present. An early diagnosis allows to detect a tumor when it is still in its early stages, increasing the effectiveness of therapy and, above all, the probability of survival.